Today we're going to show you how to prime your TPN line for a peripheral IV. For demonstration purposes, I will be using normal saline. In normal situations, you will be using either D12.5 TPN or D10 with 2.5 trophimine. What you will need a TPN bundle, which will consist of 2 Max Zero connectors, a tri-piece, it's called a trifurcated extension set, a microbore extension tubing, a filter, and an infusion set. You will also need hand sanitizer, cavi wipes to clean your area, gloves, and a drape or a blanket to create a clean area. Gloves, your fluid, and 1 syringe of normal saline. First, you will take a cavi wipe and clean your area. Once the area is dry, you can place a towel or a drape down to give you a clean workspace. Place your drape down. Then take each piece of equipment and throw it on as if it's a sterile procedure. Although it is not a sterile procedure, it is a clean procedure, but you do not want to touch your equipment until you have changed your gloves. Now you will take off your gloves, wash your hands at the sink. For general purpose, I will use sanitizer. Put on a clean pair of gloves and begin connecting your pieces together. Now that you have all your pieces available to you, take off all the little tapings. We are going to connect all of our pieces. The purpose of doing this prior to priming is so that you do not have to break the line. We want to minimize breaking the line because it decreases the risk of contamination and infection. So you take your infusion set and you connect it to your filter. You take your filter and you connect it to your yellow port. There are 3 ports on the trifurcate. You have blue for your medication line, yellow for your TPN, and white for your lipids. At this point, we will not be hanging lipids. You are only going to need your medication port and your TPN line. So you would put a Max Zero connector on your lipid port. So connect your filter directly to the yellow port on the trifurcate. Then take a Max Zero hub and connect it to the white, as we are not going to prime lipids. Then take the second Max Zero hub and connect it to your microbore extension tubing. Prime this tubing with normal saline, as this will be used for medications and will always have normal saline in the line in between medications. Connect your microbore to your blue trifurcate and flush with normal saline. Clamp the blue port. Now we are ready to connect the TPN, in this case the normal saline for demonstration purposes only, to our actual line to prime. Take your bag of fluid, remove the piece. Remove your second piece and put it directly in. Make sure you clamp the area closest to this part before you tip it up and begin to fill. Squeeze the little tube and it will fill with fluid. The chamber will fill with fluid. Hang. Gravity is your friend. Because you want the fluid to fill in semi-slowly so it does not create turbulence with air bubbles, slightly clamp below your air bubble filter. Release the clamp above and allow the fluid to come in. Hold the filter upright as you watch your fluid come in. Once the chamber fills, flip it over. Flick this little hub area as a lot of air collects in this area. Flick and flip. And you can see the bubbles are all coming out. Once your line appears to be free and clear of bubbles, you have successfully primed your TPN line. If bubbles consistently get trapped in this area, you can take a syringe, a normal saline syringe, and connect it to the hub and push the air out. Clamp it at the yellow clamp and also here. Make sure the white line is also primed with fluid and clamp it closed. Your line is now officially ready to be placed onto the patient's existing peripheral IV site.